You are welcome, everyone. Work is really bad. You are welcome. I'm sorry, guys. My network is bad. We are really suffering here in Italy. To come out is a problem now. We are indoor. Coronavirus is everywhere, disturbing. To go to supermarket now is a big problem. I'm indoors this morning. If you are going out without holding a paper, you cannot go out again. Police, yeah, carabinieri, they are everywhere now. No more going out to everybody there for house. You are welcome, everyone. You are welcome. Good evening to you all. The rate this coronavirus is killing Italian people. It's not a small thing. It just got. The only thing we just need to be careful to even go to supermarket now. It's a big problem. The time the coronavirus, the date they put now, nobody's going to church. They said next, that was April 3rd. Everything will be okay, but we still pray to God. We want everything to be okay by then. That is our prayer for now. No more school, no going to hospital. Everybody are indoor, apart from the people that are going to work. Even if you are working, before you go to work, you need to hold that paper to show to the carabinieri or polizia before you can go to where you are going to. Even if you are going out now, they will control you. They will be asking you question, where are you going to? You need to explain to yourself. This is a big problem. Very difficult for everyone to come out. To even do space and now is a big problem. Maybe you have a supermarket near close to you. You can go there to buy your things. But going to far distance, taking train is difficult for now. Elisha, you are welcome. Where I am, where I am at, they have a state of emergency. It's everywhere. Even where I am now, ambulance everywhere, parabolating. I don't know what is happening. Everybody, we are indoor. To even buy mask now to put on your nose now is a big problem. I went to pharmacy, they say they don't have. I don't know where to get it for now. It's a big problem. It's a big problem. They said the thing is not affecting Africa people. Even if it's not affecting Africa people, we need to prevent ourselves. Need to be careful for now. I hope you guys are fine. You are enjoying your where you are there. I hope you are enjoying. It's not the time for you to come out. It's time for you to relax at home, or maybe you are going to work. No time to come out now. We just need to bear it. We need to have that patience. It's just few weeks from now. Everything will be okay. By the special grace of God, everything will be fine. I don't know about other countries, whether it's still the same thing we are passing through here, they are still passing through. We don't really know. Because I called one of my girlfriends today in France. The rate of death there is very low. It's not like Italy, where we are. It's not the same at all. Some train station now, there are police there. For you to go out, they must check you. For you to come in, they must ask you, where are you coming from, where are you going. You have something to show to them before they will allow you to go. Without nothing, you cannot go. They will ask you to go back. And for police to be controlling you outside, it's not fair. It's not good. The only advice I have for you people now, and for myself, not only you people, and for myself, we just need to bear it. We need to take things easy for now. Just respect ourselves, because this is not our place. We just need to be careful because we are a stranger here, and most of them, they are not even happy. The thing is not affecting the Africa people, we blacks, because they are still imagine, like every day now I used to watch news to know what is happening there, what is happening. They are not even happy because it's like the sickness is from for only Italian here, Italian and Chinese, like Morocco, Pakistan, Albanese. I've not seen anyone. This coronavirus is affecting, apart from the Italian people, the Europe country people. Africa people I have not seen, and they are not happy. The only opportunity now they have, even if they want to share document for people who don't have document now, it's opportunity for them to share. If they will share, if Italian people will share, don't really know if they will share. They need to share document for people who don't have documents, because people are suffering. People are in camp for 3 years, 4 years, no documents. This one is a lesson to them. They should share documents for them, so that their country will be free. Coronavirus everywhere. Coronavirus. Everyday news. Coronavirus. Let me check today's news. Italy today.
We start tonight with the unprecedented measures being enforced right across Italy to try to limit the spread of coronavirus. As the number of cases and deaths rises sharply, Italy faces growing isolation, with thousands of flights cancelled and stringent controls on its borders with Austria and Slovenia. Public gatherings, including sports events, are banned, and schools and universities are closed. Italians are being advised simply to stay at home. The number of confirmed cases has risen to more than 10,000, and the number of deaths in Italy has increased by more than a third to 631. Here in the UK, a sixth person has died, and the number of cases here has risen to 382. More on that in a moment, but first this report from our Italy correspondent, Mark Lowen.
As several airlines stop flights.
Won't be able to travel in the immediate future. We've been told that we can only take trains between cities for reasons of work or health or for some extraordinary emergency. And apart from that, we must stay put. But that's sensible.
And another thing is they've put this limelight or spotlight on age groups and really, really old. But I'm optimistic about it.
Moving around requires a form which we also had to complete, allowing travel for work or health emergencies or to return home. We'd have to produce it if asked. It says here that falsifying it could lead to prosecution. Never people in Italy have conceived of the idea that they'd need this to be able to move within their own country. As we drove out, traffic seemed quieter. Roads are open, though Slovenia says it will close border, and Austria has banned Italians entering unless with medical certificates. Well, we've come out of Bologna now on the motorway to Rome, and we haven't seen any police checks for the documents, so still not clear how these restrictions are going to be enforced. We pulled over and got through to a doctor in one of the worst virus-hit areas. Hospitals are near breaking point.
We need more beds, more doctors, more nurses, because I think that in 1 to 2 weeks we will reach the top. So if we will not have more facilities, we will not know how to take care of the patients. We are facing a war now here.
In Rome, deserted tourist sites show the huge economic impact. The government now discussing suspending tax and bill payments to ease pressure. From inside the Vatican, the Pope led Mass, urging priests to have the courage to visit the sick, a risky call. And often, it's too late. Even funerals are now banned, replaced with a restricted blessing. The virus is killing and taking Italy's dignity with it. Well, this area of Rome, the tourist heart beside St. Peter's Square, is usually buzzing with restaurants. Now look at it. And the Prime Minister says they're considering imposing even more severe restrictions. One last thought, Hugh. In the northern town of Codogno, the original epicenter of the virus, for the first time they reported no new cases in the past day. A glimmer of hope, perhaps, so desperately needed here.
Mark, many thanks again. Mark Lowen with the latest there for us on the situation in Italy. He was in Rome. Well, several airlines, including British Airways and Ryanair, have cancelled all their flights to and from Italy for a month, leaving some passengers stranded. Others, including Air France, have announced drastic reduced timetables. Our transport correspondent Tom Burridge is at Heathrow Airport with the latest for us.
With airlines cancelling thousands of flights today, some people have contacted us who are out in Italy wondering how they're going to get home. Now, some people, a small number, will be able to book onto Ryanair flights, which will still operate until Friday, and EasyJet is going to operate a small number of what it's called flights in the coming days, both to bring people back to Britain and for essential travel out to Italy. Now, the government is talking to airlines. I'm told it's a fluid situation. They're trying to work out exactly how many flights are needed so that anyone who lives in Britain, who's out in Italy at the moment, can get home. But airlines are being hit more broadly because passenger numbers globally have fallen off a cliff. And that's why you've seen airlines like Norwegian Air today cutting 15% of flights out of their schedule in the coming weeks and saying they'll temporarily lay off some staff. British Airways has emailed all of its staff asking them whether they're willing to take voluntary unpaid leave. The airline industry is a precarious place at the best of times. These are the worst of times, and airlines are being hit hard.
Tom, many thanks again. Tom Burridge there with the latest for us on the airline industry's problems. He's at Heathrow there. With me here is our medical correspondent, Fergus Walsh. Fergus, again today, not surprisingly, we're focusing on Italy and the drastic measures there. Are we in a better position now to understand why Italy has been so badly hit?
Some of it is down to poor surveillance early on, around mid-January. For several weeks, this virus was circulating silently, and so cases were being missed, and the Italians have been playing catch-up ever since. A lot of transmission among families in the home between generations, and Italy has the second oldest population in the world after Japan, hence the high death toll.
When we think about the pressures on the Italian health service, which of course is a very advanced service, and then we think of our own NHS, which is clearly also a very advanced service, do you think the NHS would cope in the same way? Would it feel the strain in the same way as the Italians have done?
The simple answer is any healthcare system in the world would feel the strain with this level of pressure. And it's down to sheer numbers in Italy. This is, we keep saying, a mild illness for 4 out of 5 people, but when you've got more than 10,000 cases, you get a massive impact from the minority. It's been sobering to read reports from doctors about their critical care units being nearly overwhelmed with patients with pneumonia, with organ failure, lack of ventilators, and setting up makeshift intensive care beds in corridors. Now, we simply don't know whether we'll have that level of outbreak here. It could be not as bad as in Lombardy, but we can't leave it to luck. We have to prepare.
Fergus, many thanks once again. Fergus Walsh there, our medical correspondent. Well, here in the United Kingdom, a man in his early 80s has become the 6th person with coronavirus to die in the UK. The patient who was having underlying health conditions caught the virus here in the UK, not abroad, and died in Watford General Hospital. More than 26,000 people have now been tested for the virus in the UK. There have been 382 confirmed cases. Part of the government's plan is to try to limit the number of people who need hospital admission, and that means GPs playing a central role. Our health editor Hugh Pym has more details.
This is the sort of protective equipment which NHS staff have to wear if they're in contact with patients possibly infected with the coronavirus. Here, two nurses demonstrate how it's put on ahead of carrying out a test. GPs are now being sent the equipment for use in their surgeries. One leading GP said they expect many patients to come in, even though those who might have the virus have been urged to stay away and call NHS 111, and that'll mean non-urgent appointments being cancelled.
We do expect cases to rise rapidly over the coming weeks. Practices are routinely doing health checks, assessing people's blood pressure, diabetic control, long-term problems with heart disease and lung disease. Those routine checks will need to stop.
Some GPs have complained they haven't yet received the equipment. Ministers say it's being sent out this week.
We wanted to get the timing of the rollout right so that the equipment is there.
All residents stay at home, orders the police. From Naples in the south to the supermarkets of Rome to the financial capital up in Milan, news of the restrictions spread as fast as the virus. In Bologna today, they began to adjust to the toughest limitations since the war. Public gatherings banned, bars and restaurants closed from 6 p.m, tables a metre apart, schools, museums and nightclubs shut. Everyone is affected, Italians, tourists and expats living here, staying put as several airlines stop flights.
Well, obviously we won't be able to travel in the immediate future. We've been told that we can only take trains between cities in Italy for reasons of work or health or for some extraordinary emergency. Apart from that, we must stay put. But that seems sensible.
And another thing is they've put this limelight or spotlight on age groups and makes me feel really, really old. But I'm optimistic about it.
Moving around requires a form, which we also had to complete, allowing travel for work or health emergencies or to return home. We'd have to produce it if asked. It says here that falsifying this document could lead to prosecution. Never could people in Italy have conceived of the idea that they'd need this to be able to move within their own country. As we drove out, traffic seemed quieter. Roads are open, though Slovenia says it will close in.
I think my people now they hear so. No more going out again. Even if you are going out, you need to have your paper for you to show to them. You need to explain yourself now in Italy before going out. Without explaining yourself, you can't go anywhere. Nowhere for you to go for now. All the borders, they are closed. No more airline. Apart from train, because of people who go to work, need to use train. That is the only reason you can come out now. This is a big problem in Italy. This is what we are facing now. Everybody are indoor. This morning I'm at home. Don't have anywhere to go now. Just managing myself. You are welcome, guys. David, too bad. You are welcome, my guy. You too much. Outdoor. People, you are welcome. David, too bad. You in Italy? You can see the situation now. It's not easy, eh? No more going out. Ambulance is going up and down here since morning. I don't know what is happening nearby city here. Okay, David Tuban, okay. Yes, so it's for me to eat now and sleep. No more going out for now. No more going out for now. I do for life, I'll call you back. Yeah, calling. You are welcome. I really appreciate your coming.